Never in the NHS's long history has it been faced with a crisis like COVID-19. I want to find out what it's like to be on the front line fighting this virus that is killing hundreds of us every day. So I've been invited to spend time with the staff of Milton Keynes Hospital, who are risking everything to save lives. My small team and I have been given the opportunity by the NHS to highlight their tireless work on the front line and to allow them to tell us what we can all do to help stop the spread of this deadly virus. Thursday afternoon, 3 o'clock, a meeting of the Gold Group, the executive directors who run Milton Keynes University Hospital Trust. I've been allowed in to listen to their latest situation report. First, the figures.
We've got 63 positive COVID patients across the hospital at the moment and 35 suspected.
And then, how many staff are personally affected by the virus?
We've got 451 currently either isolating or off sick, and in our call lines we made 244 welfare calls today to people who are off, and we've had 93 contacts on our inbound staff line.
They're confident there'll be enough staff for the weekend ahead, but with one major challenge.
The pressure point, I think, is going to be our intensive care unit. So the rota is being worked out, but obviously as the activity ramps up, it's about supporting the staff because this is very new for them. I know that one of the registrars works as nursing shift in there, but actually it's about being a team, isn't it?
There's better news on testing for the virus.
We have access to probably doubling the amount of staff testing that we can do. We have to get them trained in PPE, but that should start probably on Tuesday.
Okay, so that is a good news story.
But mixed news on protective equipment known as PPE.
So we had a delivery today of 2,500 FFP3 masks, which will see us through the weekend, so that's good. Our pressure point is the gowns. Unfortunately, the reusable gowns, we can't secure deliveries over the bank holiday weekend, which is going to create some pressure. We will therefore be reliant on the disposable gowns. We think we have a comfortable 3-day supply, but that clearly creates a pressure point for the bank holiday Monday.
But again, the nature of what you're facing, or the country's facing, is an unknown, isn't it? It's an unknown.
We've been planning this now for the last several weeks. And when we look at the facilities we've got available to us and the work that the different clinical teams have been doing to prepare for this, we think actually we're in a really good place. Whether all of our plans will be sufficient or not is questionable, because actually we believe that we will probably need more staff, more ventilators, more oxygen than we currently have available to us as an organisation.
There's a sense still about sort of calm before the storm. It feels like a bit like we've got an exam coming and we've been revising and it's next week.
Many areas are quiet because non-essential surgeries have been postponed. But on the COVID wards, it's a very different story. 340 people have been treated here.
Date of tests the 10th, my mum's birthday. Yeah.
To witness frontline staff try to save lives, I will need protection.
We have brought our own hazmat kits, so masks and everything else. The Trust have asked us to wear their kit, so we look exactly the same as the NHS staff, so we don't cause distress to patients or to anyone else. So we will be leaving our kit here when we leave, so they can use it.
To stop me breathing in the virus, Nurse Claire is fitting me with a skin-tight mask.
Get a nice tight fit.
No matter how much I move around, it must stay tight. With the mask, I can't taste the chemical solution that's being sprayed.
Mask right down. Yep, that's it.
But when it comes off... Yeah, the mask works.
Thank you.
Thank you.
Intensive care is where patients with the most severe COVID-19 are treated. Entrance to the ICU is understandably restricted. So it's our camera operator and me with the microphone. Hi. This is the first time I'll be going into intensive care, and I'm now being gowned up. My mask on now. Push those in like that, so it's right against my cheekbones.
Yeah, your face. Yeah. Visors.
Yeah.
2 pairs of gloves.
Just put the PP kit on, and you guys are in it for hours and hours and hours. I've only had this on literally for minutes, and it feels uncomfortable.
This is one of the most difficult things about COVID, especially for the nursing staff who wear it hours on end.
So we're now actually going into the area where patients with COVID-19 are being looked after. They're sedated, aren't they, the people?
Yeah, so the vast majority of the patients here are on ventilators. So by that we mean a tube has been put into their windpipe, and that tube's been connected up to a ventilator, and in order for them to tolerate a tube, which can be quite uncomfortable, they're being sedated, so that our ventilator tries to expand and open up parts of their lung.
The consultant in charge here is Hamid Manji.
Welcome to our intensive care unit. So this is our intensive care unit in normal times. In abnormal, unprecedented times, we have expanded to another intensive care unit. We call it ICU 2. And that's in the other side of the hospital. And we have the facility for another 8 patients there, possibly 9.
So what qualifies a patient to end up in intensive care?
One is straight from the emergency department. So they come into hospital via an ambulance. We're pre-warned that they're coming in. They're acutely unwell. We assess them in the resuscitation department. Either they're well enough to go to a ward, or they're not, in which case we would consider bringing them straight to the intensive care unit. That's pathway 1. Pathway 2 would be that they would go to a ward where they will have some oxygen or some further treatment, and if that failed, we would review them there and then consider to bring them here from the ward.
Because it's a new virus, there are many unanswered questions about COVID-19. Why, for instance, do some suffer mild effects while others deteriorate quickly?
In reality, we don't know how it's going to affect people, but what we do is assess everybody very carefully on an hourly or even more than an hourly basis, and if they deteriorate, we have an action plan in place to escalate their treatment appropriately, eventually, if necessary, to bring them to the intensive care unit.
Everywhere I look, the staff are calmly, professionally doing their best. 9 patients are on ventilators here.
All my career, 20 years as an intensivist, I've never seen this. It's unprecedented, and it's because it's not just the numbers of patients that are coming in, it's the combination of the patients as well as the fact that they're young and they're incredibly sick with significant lung or breathing problems. So this is typical. We have a patient on a monitor, the ventilator, and this machine is a dialysis machine. This patient is very, very unwell, and the lack of oxygen in his body is causing a problem to other organs. So his heart is not doing as well as it normally would. His kidneys have failed.
We need oxygen, don't we?
The body needs oxygen. Every single organ is dependent on a supply of oxygen. And if you can't get it there, those organs will slowly start to fail. And we call that multi-organ failure.
Hamid shows me one way they're giving more oxygen to patients.
If I can take you into this room, we have a patient here who is prone on his tummy, and I'll explain that to you in a moment.
Okay. This patient is on a ventilator, but the team has found it helps if he lies on his stomach for a period of time.
So that's called prone, which means face down, tummy down. The point of treatment here is to match the oxygen supply with the blood supply. The oxygen and blood have to come together, and then the blood transports the oxygen around the body.
Right.
Sometimes, if that is mismatched, it's easier for the patient if we turn them on their tummy, face down, and we try and rematch the blood supply with the oxygen supply. And then we do that for up to 16 hours, and then turn them back again. And that turning, we found in the COVID population, is making a significant improvement to the oxygenation of their body. In about 20 years worth of intensive care experience, I must have done this about 10 times, And in the last 2 weeks, we've done it about 10 times. So it's extraordinary that this particular virus is causing us to have to do this kind of manoeuvre on the intensive care unit.
And the patient appears to be responding.
The screen above the patient, ECG.
Correct.
The purple one is...
The oxygen in his bloodstream.
And that's at 100,
right? 100. This is fantastic, because this gentleman's oxygen saturation about 3 days ago was in the 80s, which is very, very low. He's now at 100.
So this is good news?
This is very good news for this gentleman.
All I can say is the care that patients are receiving here is second to none. It's the professionalism that's being displayed, it's the organisation, but most important, it's the love. People are being treated with so much care and so much love here. So I've never been in a position like this in my life, but NHS staff here are not only highly organised, incredibly professional, but they care. They really care about the people they're looking after, and that is the most overwhelming thing. Yeah, pretty emotive place, I have to say, but the care and the love is overwhelming.
I've been given the privilege of seeing how the frontline staff of the NHS are coping with the COVID-19 crisis, filming with the doctors, nurses and the whole team at Milton Keynes University Hospital Trust. But it's important to stress that the hospital remains open for people in need of emergency treatment.
So we're just about to go into the emergency department. Katie and Kieran.
Hi, how
are you guys?
Yeah.
Right. This is, well, normally the busiest part of the hospital, right?
Yes, usually.
Is it still?
At times it can be busy, but recently no. Numbers have tailed off quite significantly.
There's going to be emergencies that people need to come to, and I think NHS-wise now we need to give that message that we're still open for business.
24/7. You know, we'll still see everybody. We need to say to people that if they do need our help, then we are here and we will see people.
Is it one of the reasons that basically people aren't, you know, playing sport on a Saturday afternoon? They're not going out and getting drunk and falling over?
People aren't out in their cars so much, not having the trauma calls.
Road traffic collisions?
No,
not
the
as
Sunday
much.
afternoon football
No, absolutely.
injuries,
So all our bread and butter work has tailed off a little bit.
But there's been a big change here.
So there is a barrier there. Can we go up and have a look at it?
We can have a look, yeah.
We are in the green zone for normal A&E cases. Over there is the red zone for A&E COVID patients. Plastic sheeting separates the two. The red zone means full protective gear.
So you've effectively got two
ED departments, yeah, we have. Yeah.
Getting the large supplies of essential protective kit, PPE, to the front line has been a challenge. The Trust's chief executive believes there's a basic reason why.
This is a new world for the NHS, don't forget, and the volumes that we're talking about and the critical nature of getting that PPE in the right place for that individual clinician is something that we've never done on this scale before.
And staffing levels have never been as crucial. Nursing Director Nikki has to find enough nurses to cope.
So staffing wise, we've got 450 people that are off, that are in either isolation or shielding. So we have done some very difficult modelling about how might we manage if you only have 2 nurses that are trained or 1 nurse that's trained, and bringing other disciplines in. So how might we work with a pharmacist instead or a physio. We had 290 external volunteers that want to come and help.
What about ex-nurses?
Yes, so we've had quite a lot of nurses that want to come back and work. Today, quite a few staff asked if they can work more than 60 hours. We've provided accommodation in a local hotel, and they have shielded themselves from their own families so that they can still work.
They're not going home to their kids?
No,
They're not going home to their husbands or their wives?
This is what we do. So we have this thing where everybody's going, we're heroes and everything, we're fighting a fight. I don't think people actually see themselves as heroes at all. I think they just think this is what we do as nurses. And
Well, we see you as heroes.
We're human beings fundamentally at the end of the day.
Yeah.
And I think this is the hero thing we have to be careful of, that people don't feel that they've got to man up and be the hero and not get upset. Because if you don't get upset about the situation that is unfolding, then
you're bottling
actually,
it up.
yeah. And so that's not a good thing. And then people will become desensitised to what's actually happening around them, and we don't want that.
Medical Director Ian is in charge of the doctors here. He fears hard choices are ahead.
Imagine a situation where we've got 20 ventilators and all of them are in use. We've got no more ventilators. We phone around other hospitals, they've got no more ventilators either. We have to make a decision for the next patient coming into the hospital, who we haven't met yet. Of the 20 patients currently on ventilators, who are the 2 or 3 patients who, to be completely honest, aren't making any progress? They're getting worse, not better, who aren't going to survive. And in some circumstances, we might have to withdraw treatment on that basis. That's not something we've done in the UK ever.
How are you going to cope with making those decisions?
It's a really difficult situation. The whole reason this country's on lockdown is to try and reduce the rate at which patients are presenting to hospital, reduce the rate at which people need ventilators, so hopefully we'll have enough ventilators for everybody. That's the hope.
We were allowed briefly into the new second intensive care unit created for COVID patients. Here, Paul Breeze, aged 63, a retired military police officer, is not on a ventilator, but is receiving oxygen. Paul requested we film him so viewers can see just how serious the virus can be. A message endorsed by Hamid, the consultant in charge of intensive care.
So that's a very key message. The isolation, the staying at home, the not giving it to other people, be it your neighbour or somebody at work or somebody in a supermarket. Keep your distance. If you don't need to go out, don't go out. We are in the UK still in an upward trajectory. We need to change that, as they have done in some other parts of the world. And they've done it with really strict rules. So although I don't want to be a disciplinarian about it, genuinely, it saves lives to isolate and to stay.
Hamid, if you don't want to end up here...
Correct.
Then listen to the advice and abide by the advice.
And the other bit that I would just like to say to the people out there that are listening is it's young people we're seeing on the intensive care unit. It's not that you have to be ill or that you have to be old, but young people are suffering with no illnesses in the past, and they're suffering in a way that I have never seen before. They are critically unwell, and some of them sadly are not surviving this. So the message, without being too dramatic, please stay at home, please isolate, because it's saving lives, not just your own, but the lives of the people around you.
How are you preparing for what may happen at Milton Keynes?
We've become a hospital that is effectively on a war footing. The reality is this feels like a war zone and a field hospital. I'm doing 12-hour shifts, which I haven't done since I was a senior house officer 30 years ago. But we're doing that now as a group of people to try and manage the overwhelming number of patients that we're seeing and how sick they are.
So far across the NHS, 27 staff have sadly lost their lives to the virus. Hamid has his own story.
I have had COVID. I've had 10 days of fever. I've had myalgia and the rest, thankfully. And I don't know why, but thankfully it hasn't affected my chest. So, in effect, I got over it, and I'm better, and I'm back at work.
So, we're actually going to witness a happy outcome, which happens to the majority of people who are admitted with COVID-19. We're going to see someone who's being released from hospital right now. He kindly agreed to speak to me.
George, you've just been released. You survived COVID-19?
I survived COVID-19 because of the hospital. Because I was down for about 13 days. 13 days sedated.
Did you think that you weren't going to get out?
Yeah.
You thought you were going to die?
Yeah.
And what do you think about the way you've been looked after?
It's excellent. Excellent.
It's great because he was so sick when he came to us, and in like 3 days you're back on your feet again, and it's amazing. It's quite emotional.
She's great. She's one of the best people I've seen.
You have been away from your family for a very long time. I am not going to stop you now from seeing your wife. Good luck.
Thanks.
And I have to say congratulations.
Thanks.
George's brother-in-law is here to meet him.
You look different.
What's going on? Did you think you were going to see him again?
Yes, he's a fire, and he's back. You know, he's back. Don't get used to getting chauffeured around. You know.
He's fell over a few times.
This is how it's done.
Quite emotional seeing George go.
Yeah, that's what nursing's all about, is to see people going home like that. And yeah, it's so nice to send people back to their families, because his wife probably hasn't seen him since about the 23rd of March. It's touch and go. When he came back to the ward on Sunday, he was very unwell. I'm shocked that he's going home today. He's done so well, but mentally he's strong and he got himself through this. And he's got obviously the love of his family, which pulled him through.
And he's got a lot of love coming from the likes of you.
Staff, yeah, definitely.
How important is that personal touch, the love, the caring?
Oh, it's very important. It's the essence of nursing, I think. So if you can't do that, then you can't nurse. So yeah, it's great.
I know we won't hold you up now, you're really busy, but
Yeah.
thanks for your time.
Thank you.
Thank you. The overwhelming number of people who come to hospital with COVID-19 survive it. But those that actually go into ICU, into an intensive care unit, well, there's a 50% chance that they won't make it. So George is a very lucky man, but he couldn't emphasise enough the care and the love he received while he was here. And as Vicky says, when you witness someone coming through that and see them reunited with their family, that's what makes it worthwhile doing a job like being a nurse or a doctor.